Hey everyone, I'm Jennifer Blevins-Smith with Integral Clinic Solutions in Oregon, and you're watching my channel, Navigating the Business of Medicine. Today we're going to talk about things that should be thought about and considered before moving forward and opening your own medical practice. If you're like most medical providers in the United States, your background in medicine was very strong and rigorous in disease states and identifying anything that could be affecting patients and being able to treat them appropriately. You probably weren't offered any business classes in medical school or in your medical training, or even have courses talking about opening your own practice. I commend providers who want to open their own practice because it is a lot of work, but it can be very rewarding. I'm here to help you think about some of those questions and things to consider before moving forward with signing any contracts or backing anything with any financial obligation. I've broken them down into 4 categories, or 3 with a summary at the end, if you will. It's personal, financial, logistics, and then the risks in each category, just as to review. The personal category. The number 1 question I would ask is, why do you want to open your own practice? Is it because you live somewhere where they don't offer any kind of larger entity of employment, or are there no open jobs where you want to live? Is it because you've worked for a large entity and you don't like the restrictions and regulations that are placed upon you? The reason for wanting to own your own practice should be very, very genuine, and in my opinion, open to being not only a good practitioner and offering best patient care, but also for wanting to own a business. There should be 2 parts to it, because owning a medical practice has 2 parts. There's the patient care side and there's the business side. Medicine is a profession, but healthcare is a business, and you're doing both of those by opening your own practice. If you share your life with someone, whether it's children, parents, spouses, significant others, it's important to involve them in this discussion as well. They need to understand the commitment that's going to go into this, and if they're willing to support you in this endeavor. Financially, do you have a lifestyle that has been dependent upon a certain salary? If so, are you okay with possibly not getting a salary for a year or 2? Because the reality is, as a new private practice owner, you may not be able to bring in a salary for yourself after paying overheads and putting whatever money you do make back into the business. Is your family okay with that? If you're the only provider in your office, the chances of you being able to take a vacation or not being on call after hours or on holidays is very unlikely. How are you going to handle this situation? Are you okay with not being able to take a vacation for a while, or is your family okay with that? Have you thought about who is going to cover your after hours call or your holidays? If you think that locums tenens is a solution, yes, that's an option, but you also have to pay those people quite a high penny actually to cover for your practice. So if you make any money while you're out, then that money is probably going to go to paying your overheads and their salary. Have you thought about, God forbid, if something were to happen to you, you were to get very ill or incapacitated? Who is going to run your business then? Most providers have some kind of mid-level provider working with them, but there are certain things that they can't do based on their license restrictions. These are things that really need to be considered before moving forward. Now into the financial category. Do you have the money to put up and back a new practice? Or are you going to need to go to a financial institution or some kind of investment company to help you? I suggest, before getting even to this point of asking all these questions, to put together a business plan, a budget, a pro forma, we call it, for opening practices. Gives an idea of how much you're going to have to spend just to start up and get operating. I have a video on this, and I'll put the link in the description because I encourage you to listen to it, because it will explain what a business plan is and why it's important. Also in the financial bucket, we want to discuss any kind of CPA that you may have involved or need to get involved, someone who has experience working with private practice owners specifically. They can help navigate your tax liabilities and tax deductions and help you be the best with your money that you can. You retained an attorney that's familiar working with providers in the medical field that can help navigate on how to set up your business appropriately and all of the regulatory and compliance things that you need to do in order to be a successful practice. Logistically, have you done a market analysis to figure out where's the best place to open a practice where you can have patient demand? Have you considered the patient population in which you want to see? Are there other competitors in your field near to you that other patients may go to? Is there anything that you do or can see that would set you apart from your competitors? How are you going to get your name and your business out there? How are you going to let your referring providers know that you're available of taking new patients and that you're a new open practice? Are you going to focus on getting your website started early and a marketing campaign early? Have you decided how long it will take for you to open your doors after considering how long it takes to contract and credential and possibly do any renovations in a space that you may be leasing to see patients? Renovations can take a while, and with the pandemic, I hear that contractors are hard to find. If you aren't sure about the contracting and credentialing, I have a video on that, and that will be in the description for you as well, because it can take 3 to 6 months just for that. Have you thought about what kind of medical model you want to offer in your clinic? Do you want to do traditional, where you see patients and you bill the insurance for those visits? Or do you want to do a concierge type plan where patients pay you directly for a certain service or bundled services where you're available all the time to them to address their needs? Or do you want to be a direct PCP? Or do you want to do a rural medicine model? There's so many things out there to think about that most providers don't even know exist. That's what leads me to my next question. Have you thought about bringing on a consultant or a medical management, such as my Integral Clinic Solutions, that we help providers navigate everything that needs to be done to start a practice? Yes, you are very good at knowing about patient care and the services you want to offer, but then you have to think about things such as human resources, hiring staff, supply ordering, setting up your IT and your network, getting your EHR all set up. Even though you pick an EHR, there's a lot of behind the scenes that needs to be set up in order for you to be able to use it successfully. Billing and collections. Those are so many things that providers, especially who have worked for other entities as an employee, haven't had to know much about or even indulge themselves. Have you thought about how much it's going to be to get malpractice as a solo provider? And liability insurance as a business owner? Are you willing to take the risk of dedicating more time to your profession and your business than to your family and friends? Are you willing to take the financial risk of not being able to have a salary for a few years and being able to pay your personal bills? Of course, I try not to be pessimistic, but these are things that you need to think about because it is reality and these are things that can happen. I feel it's very important to be honest with providers when they come to me and want to open their own practice, and let them know that it's not cheap and it's not for faint of heart. The more attention that you put into your business and the more time you put into your business in the beginning means it's going to be more successful. Hopefully you put people in place that will be able to support you in the business, such as strong managers and billing and collection personnel, but you still have to be involved. I know many private practice providers that unfortunately took for granted that their managers were doing everything they were supposed to be doing, and they were embezzling money. And it resulted in them losing a lot of money. So I suggest that the more involved you are, the better it is. I would say more time is needed in the beginning and to get things smoothed out in the opening of the operations, but it should smooth out and you should be able to get into a groove and a routine. But having more people involved, such as a CPA, a bookkeeper, and people with checks and balances built into the system with one another is very, very important. I would include that in your business plan when it comes down to who's involved in the business and what their roles are going to be. So if you are a provider who has opened your own practice or are thinking about opening your own practice, I encourage you to use the comments below to give any suggestions to your colleagues on things that I may have missed or things to think about, or any kind of tips and tricks that they should know about. Please ask me as many questions as you would like. I'm always here to help, and I love learning and hearing from all of you. If you feel that my channel is going to be beneficial, I want you to subscribe and then hit the little bell icon so you get notifications when I release new videos. If you like this video specifically, if you would smash that thumbs up button right there and help with the YouTube algorithm, that will help me help you. And I really, really hope that this will help you start the wheels rolling when it comes to you opening your own practice or opening another practice. And I hope that you will tune in next time, because this is just the tip of the iceberg of the things we're going to talk about when it comes to the business of medicine. Thank you for visiting my channel and have a wonderful day.